Hi, and thank you for the opportunity to share the Biopata Hospital in Nepal. I'm Tyler Servant, Project Director at Sharon Davis Design. I'll start by discussing the project context, followed by the design strategies in the completed campus, and to end with the impact of the project. Nepal is an incredibly beautiful country with rice fields that terrace the countryside, ornate temples and rich cultural traditions, and of course the majestic Himalayan mountains. But Nepal's rugged terrain makes most of the country highly inaccessible, limiting access to healthcare facilities. And its vulnerability to natural disasters further complicates infrastructure and social services. In rural Nepal, the doctor-patient ratio is, on average, 150 times worse than is recommended by the World Health Organization. Enter our client, Possible Health, a nonprofit organization working in partnership with the Ministry of Health to offer free, high-quality medical care in rural Nepal. In 2009, Possible Health reopened an abandoned hospital on a 3-hectare site in Acham, a district where there was not a single doctor for a population of 250,000. Soon the facilities were at capacity, and Possible Health reached out to us with a bold vision and a limited budget to phase out these original buildings, replacing them with an upgraded, expanded hospital complex. At the time, the buildings had no formal sanitation system, electricity was unreliable, access to clean water was limited. Also, there was no insulation or climate control, allowing indoor temperatures to range between 4 to 40 degrees Celsius. And on top of these challenges, we had to keep the hospital operational throughout construction. So new buildings had to be constructed adjacent to the old before those could be demolished. The remoteness of the site was also a huge challenge. Biopata is a 10-hour drive from the nearest regional airport and a 3-day drive from the nearest manufacturing centers in Kathmandu and Delhi. Access to the hospital is by this single 2-lane highway that winds through the Himalayan foothills, which can easily be blocked by fallen rocks and washouts during the monsoons. Due to the poverty and limited infrastructure in the district, most patients travel to the hospital on foot, even pregnant women. For patients already based in Acham, this is a journey that can take up to an entire day, but if coming from surrounding districts, the walk can take up to 5 or 6 days. While there are other healthcare facilities in the region, the private hospitals are unaffordable to most, and the few public hospitals are understaffed and underfunded. Thus, poor patients in need will travel further distances to Biopata in order to seek affordable treatment. With limited telephone access, as many as 500 new patients arrive unannounced each morning and then must wait for hours or even days to be seen. So how did we respond to these challenges? The original hospital was disorganized with inefficient workflow and no formal waiting areas. For instance, on our first trip, we were shocked to see doctors running between the emergency room and surgery through throngs of waiting patients. Our master plan grouped the more public outpatient functions, shown in orange, around a main courtyard and located the more private inpatient facilities in blue around a smaller courtyard beyond. We kept the housing for staff down the hill away from the main buildings. We used the natural topography to articulate the various spaces, with the administrative building at the highest point on the campus overlooking the rest of the campus, and the staff housing in the more secluded locations downhill. In form and materiality, we were inspired by the mountainous landscape and its vernacular buildings. Traditional houses in Acham are 2 to 3 stories and are constructed of mortared stone and finished with paint and reddish earthen stucco. We substituted reinforced Rambed Earth, which has better seismic resistance, while retaining the earthen quality that is so familiar to patients. Doctors have told us that the buildings remind them of home. Rambed Earth also addressed the cost and difficulty of transporting building materials because we were able to source all the soil locally from within 2 kilometers of the site, drawing sand and small aggregate from the Seti River in the valley below. The laborers were also local and saw the job as an opportunity to learn a new transferable construction method. Rambed Earth also provided the thermal mass we needed to passively control the indoor temperatures. The only rooms in the new hospital that have air conditioning are the 2 operating theaters. We used local stone for the foundations, footings, pathways, and retaining walls, and local saw wood for all built-in furniture and shading louvers. Clear-story windows provide daylighting and allow stack ventilation for passive cooling. We integrated shading canopies throughout, which also provide cover during the rainy season. The roofs are pitched at an angle optimized for the 100-kilowatt photovoltaic system, which produces more than enough electricity to power the entire facility, including all the medical equipment. We also incorporated water management strategies, including rainwater diversion in the housing and bioswales to manage stormwater erosion and runoff. Large cisterns collect water from 3 springs for the hospital's water supply. Now let's quickly look at the results. Patients enter the campus from the main road. They first register on the building on the left before proceeding through the open passage. Here you see the polycarbonate canopies, beneath which are built-in benches. On the interior, you can see the effect of the clear-story windows in spaces such as the laboratory and the emergency room. Here we are in the first courtyard, the primary waiting area for patients. From here, open-air passageways lead to medical offices and more secluded balconies. I just want to point out as a quick aside, on the right is Dr. Rekha's office. Incredibly, she is the only dentist and oral surgeon in Western Nepal, serving a population of 1 million people. We plastered the Rambed Earth on the interiors, both to brighten the spaces and create a cleanable surface. The exterior is sealed only with linseed oil. The east side of the public courtyard is left open, and the canopy frames views to the mountains beyond. Maternal health is a main focus of the hospital because the region has one of the highest maternal mortality rates in Nepal. The campus has special areas for women, including the antenatal exam room and the maternity ward. Here you see the smaller upper courtyard, which serves as a quieter outdoor space for admitted patients. From here, stone stairs lead up to the administrative building, inside of which are staff offices and a 60-seat canteen with large windows that overlook the campus and the hills beyond. The 10 single-family staff houses are set apart from the main buildings. And for the doctors who live here with their families, Bayalpata Hospital is not only an institution, but a home. Unlike in the medical spaces, we left the Rambed Earth exposed on the interiors of the housing. Lastly, here's the dormitory for staff and for visitors, which is nestled into the hillside below stone retaining walls. The dorm has 8 private bedrooms with built-in seating along the corridor and a central common space. Whereas in the medical facilities, we integrated concrete columns. In all the housing, the load-bearing structure is entirely Rambed Earth. So this project has already received much positive attention in Nepal, with the Nepali Times praising the hospital as a, quote, model of accessible and affordable medical care. Over the course of construction, an informal economy has sprung up across the street to cater to all the new patients, which incidentally demonstrates the kind of typical quality of some of the local contemporary construction going on nearby. The hospital now has 2 operating theaters, one for each of the only 2 surgeons in Western Nepal, Dr. Bikas and Dr. Pawan, who are both based at this hospital. The medical staff has applauded the better indoor working conditions. And because of the high quality of care and welcoming environment, the hospital now serves more than 100,000 patients a year, which is 8 times its original capacity. During the course of construction, our project team overcame a number of hurdles, including a change in government, border closings, and the earthquakes of 2015, which caused avalanches that blocked the road to the site, the one that you saw earlier, for about 6 months, delaying delivery of building supplies. And it looked messy, but we were able to successfully phase the work over a 5-year period, so the hospital could continue to serve patients throughout construction. To commemorate the completion in June, our contractors built this temple to Shiva on the hillside overlooking the hospital. Shiva represents the natural cycle of destruction and creation and is symbolic of the hospital's rejuvenation as a model for rural healthcare. Finally, we were able to meet the strict budget, building this 45,000 square foot facility for only $60 per square foot. That's 585 euros per square meter. Thank you. Be happy to take your questions.
Can you talk a little bit more about the Rambed Earth? Was it something that was prevalent in the village already, in the area?
No one was using rammed earth in the kind of current form. The earthen materials are certainly very common, and that's something that we were trying to kind of pick up on. But in terms of rammed earth, there was only one structure in Kathmandu that had been built out of rammed earth in the country prior to this project. So we were actually able to work with them to do some prototyping and mock-ups to ensure that this would work in this area. Also, of course, did a number of soil tests to confirm that the soil within this area would work for that. But this is the largest rammed earth structure in the country to date.
And so stone wasn't an option in this area?
So we did use the stone for all of the footings and all of the retaining walls. There was supposed to be a small guardhouse that was constructed that just got value engineered out. We did build that of stone. So smaller ancillary buildings were built out of mortared stone. In this case, because of just the higher safety factor of the hospital, the rammed earth, in combination with those concrete columns, the concrete ring beams, the concrete plinth beams, met those kind of stringent security requirements.
It was a seismic advantage as well.
Exactly, yeah.
And now what? If it was so successful, it doesn't look like there's a great deal of room to keep building.
Yeah, that's true. And unfortunately, the hospital's needs kind of evolved over the 5 years. The original program that we were handed about halfway through construction got upgraded to an additional 2 buildings that had to be integrated within the center of the campus. So there were originally, some of the existing buildings that were originally planned to be kept actually got demolished to replaced by new buildings. I think one of the needs right now is that they would like to add a separate canteen for the patients and for the patients' families, because a lot of the patients travel with their families. And so currently that's just being housed in a temporary structure. They didn't have the funding to go forward and to continue to build that. There's a little bit of room further to the north of the campus, which was oriented to the right side of the page. But expansion, I think, will be a little bit difficult just based on the topography and kind of the site limits.
And what about the site itself? It doesn't look as if you did a lot of work to retain water, to retain soil, any of...
Well, so there are bioswales that are not quite visible in these images. One of the most disappointing things for us is that we had a whole landscape design that got value engineered out when the 2 new buildings were added to the project. So that budget could not be increased by Nepal standards without having to go rebid the project. Yeah, yeah. And so we were kind of forced to mothball this landscape piece for a later phase, which they still hope to do within the coming years. But there are retaining walls, and all of the courtyards have drainage that takes the water down slope into those bioswales, and then kind of funnels them out through this image beyond kind of the staff housing downhill into there's sort of it's not so strictly defined as a kind of retaining area, retention pond, but there's a lot of the site to the north that's allowed for that drainage area to collect in.
So as I look at the project, in this environment of rapid development and constant change, I wonder if you have conceived of the building as something that is meant to be a first piece in a growing or transform. Will it be kept when the next stage comes along, or will they have to demolish this one and replace it with another one as well?
I certainly don't think that they have any intention to demolish this. In terms of expansion, there are, again, as I mentioned, there are probably 2 or 3 places on the site that can continue to provide for, say, an additional piece of the program. I think what you may find is that that upper courtyard also could be phased out for an additional building. The main courtyard really is critical for a waiting area for patients. But that upper courtyard, it really just serves as a kind of a hub for movement in and around that. So these buildings are, they're built to last. They're built to be here for the next few hundred years, I think. So we would hope that these wouldn't be demolished.
Thank you.
Yeah, in a way, it's almost impossible to say something critical about this project, because it's all so good what you did with this whole new intervention, you could say, apart from the architecture. But in a way, even for a low-cost building, I wonder why certain elements are so repetitive in the design. Like, for instance, the window sizes, the way how you played with the roofs. That all, you could argue, are maybe having to do with facts of cost, maybe. But on the other hand, with particular kind of crafts you can use in these particular local conditions, you can also activate craftsmanship, I would say.
Yep.
Why don't you did that?
No, I think you make a really good point. And it's something I think that we learned ourselves, kind of the hard way. As a good example of that would be the entry gate, which we designed to be a kind of, I think it's we're kind of inheriting this from the Western world, thinking about fabrication, industrialization. So we designed the entry gate to be kind of a panelized system that could be made kind of in a shop, and repetitive elements that could be then changed around in different orientation for that variation. When we actually saw I wasn't there while they were actually constructing that piece, I only saw the photos of them constructing it, and they were just building it right in place, right at the gate, in the vertical axis, not even flat. And in which case, you're right, we could have done anything. It could have been an entirely custom piece along that whole front for the same cost. So I think it's a learning lesson that we've definitely gained from this.
Good.
I just want to add something. For me, it's good because it doesn't look like in hospital. I think that's important. It can be housing.
But that's good.
It's a good feeling, It's because
Right, it doesn't have an institutional quality.
No, it's all these hospital buildings around the world. I don't want to go in. So.
Thank you very much
Thank
indeed.
you.
Great project.
Thank you.